Are you a diabetic? If you are a diabetic, how important it is to know about diabetic neuropathy? What are the symptoms of diabetic or peripheral neuropathy? How to recognize the signs and symptoms early, and what exactly you should be doing? Let's get into the video. Howdy guys, this is Karthik, Physiotherapist. Welcome to my channel, Karthik Physio. Diabetic neuropathy is common among diabetic patients, and that's because the lack of blood supply to the nerves. When the glucose level increases in the blood, it causes thinning of the artery walls which is supplying to the nerves. So when there is lack of blood supply to the nerves may become hypersensitive, their function is altered. The stages of diabetic neuropathy is, in the first stage, you may start to feel just numbness. And then it can progress to the second stage where some people may feel more pins and needle sensation or tingling sensation in their feet or their hands. And the third stage is the consistency of the pain. The pain may last for a longer time. Months and months. So the pain intensity may not be necessarily very high, but the pain may stay there for a longer time. At the next stage, where the intensity of the pain goes up, so along with the consistency, the pain is present constant, but the intensity of the pain. Like some people may have too much hypersensitivity. For example, if somebody have a blanket on the feet, they may not be able to tolerate that sensation. So that kind of intensity. And the final stage will be loss of sensation. The only way to prevent diabetic neuropathy will be to control the sugar level. These numbers really matter if you are checking your blood sugar before and after meals. Before meals, the normal blood sugar level should be ranging from 4.4 to 7.2 mmol, or ranging from 80 to 130 milligrams of blood sugar is considered as normal, even for the diabetic. And after meal, within the next 2 hours after the meal, the blood sugar level should be below 180 milligrams or 10 mmol. So that's a safe level. You see the range is falling beyond it. It means your blood sugar level is constantly high and it can cause damage to the arteries and it can lead to a diabetic neuropathy. But once it passes on to different stages, the diabetic neuropathy or neuropathic pain is not completely reversible. So it's better to act when you recognize these symptoms. And the other way to know more reliable blood sugar level is like HbA1c levels, which can be performed every 3 months to 6 months. Well, it should be below 7 mmol. So if you maintain that level, the possibilities of you getting a diabetic neuropathy might be less. Once you're diagnosed with diabetes, ask your doctor and ask them to be referred to a dietitian. They can give you a plan which you can carry out confidently and see results. Physiotherapist, I can advise a proper exercise program. So far, I made videos about how to do a proper walking and how to perform exercises at home if you are a diabetic. If you want to do a walking program, most likely I wouldn't say it's completely adequate enough to control the blood sugar. So what I would do, I would plan my 15-minute walking, and before that I perform home exercises for 20 minutes. This 35 minutes mean for your exercise to control diabetes. It's important to do both. If you do moderate intensity walking, let's say you can walk but you can't talk, that's a moderate level intensity. The high intensity level of exercise, walking, could be a jogging, a fast walk, or you're doing in a treadmill. So those kind of intense exercise, if you are doing them, you need 15 minutes. If you do Moderate intensity exercises is 30 minutes a day. Overall, you can go for 150 minutes a week. If you're doing 30 minutes a day, 5 days a week. And if you're doing a high intensity exercise aerobic program, you can do 15 minutes for a day. 75 minutes a week minimum is recommended. Diabetic neuropathy, the key thing is to prevent it. And then even if you have the first level, second level, or third stage or something like that, it's better to act now doing exercises. Exercise, diet, medication, they should work together. Please feel free to comment if you have questions or opinion. Please share this video if you like it. Please hit the like button. And I'll see you in the next video with more important information. Until then, bye from Karthik, Physiotherapist. Have a nice day, guys.